So this is our new 4 silver bed floor. It's a progressive care unit, which is a step-down unit from critical care and 1 step above medical surge. This is a layout we have elsewhere in the building, but the last floors were built 10 years ago. So technology has changed significantly on the biomedical side, as it has on the built environment side. So we've chosen to go with largely a modular wall system, a pre-manufactured system, both in the patient rooms and also in the core area of the service support for nursing stations, medical rooms, medication rooms rather, and physician offices and dictation spaces.
We had a good level of certainty that it's going to pass or it's going to work out acoustically, but the trick is how much, the second objective of the test is how far can we open the plenum above and still maintain the performance.
So the systems in the wall are such that we can access them at any time by removing any of these wall panels. The joint system is such that we can add brackets and new things to be fastened or attached to the wall without interfacing with the wall or making dust in drywall and having paint patch issues to make. All the devices, the finishes are top-notch. We've got strength of about 10 times what drywall would be, so we don't have the issue of impacts and other things taking a room down due to a cart or something going through a wall.
We were trying to minimize the things that actually go over the patient's head so that we're not leaning over them as much as we always find ourselves doing. So we tried to create the ability for the nurse to do her job from either side of the bed. So we've got the medical gases on both sides. We've got access to the suction and things on both sides. And then we also did the with making sure that outlets were not only available down below so that we don't have to keep spending all of our time bending, but also that things are easily accessible, particularly for a lot of the items that we bring in and out of the room, plug into the bedside for only a moment and then take away.
So this is an isolation room, so it has an ante-room to allow nurses and other medical staff to put on personal protective gear. If we have a patient here that has something infectious that we want to control significantly what the environment is. And this is also part of the modular wall system. The door is a component of that. And this room allows for complete setup and preparation and cleanup for any staff coming in here so that they're safe and not transmitting something outboard of the isolation room.
In a traditional wall construction, there is a dip or a weakness in the performance of the wall that takes place at high frequency. In the integrated system, that dip did not actually occur, so the actual performance of the integrated wall stayed flat. Most of the intelligible speech is in the mid and the high frequency. This is frequencies of the audible range, and this is where the consonants are. The intelligibility of speech is more in the consonants, and the power of our speech is in the vowels. So this wall, when you compare it to a traditional wall, has more capability of isolating or reducing the high frequencies in a traditional wall.
One of the things that we worked hard on was the design of a television for the patient space so that they'd have a nice television, but it's always a source of concern in a patient room because the televisions typically get dusty and dirty and they tend to collect a lot of the kinds of bacteria and things that we don't want to exist in a patient room. So this TV is designed to be built behind the glass so that you can touch it and it's fully wipeable. The infection control gaskets that go in between the panels help to make sure that things don't get dirty in here. And then it also makes it really easy if we do need to have any downtime to do any sort of repairs or adjustments to the television. It's just a simple pop off of the gaskets. Plant ops or engineering can come in and do what they need to do to the TV and in the room and be done with it with very little disturbance or disruption to the patients at all.
So we're very pleased with the potential here. This is the first time we've done something on this scale in prefab and modular, but we're really liking what we've seen so far, and we're going to be really excited on Monday when we can open it up and test it with patients and staff.